Tell us when. This is so fun.
Whenever you're ready. Okay.
Let's do, okay. So it's connecting.
He smiles.
Smiles at my. Should I take off my mask?
Yeah, give him a little,
let's do
give him a little something.
Welcome to Contour Dermatology. Today we're going to be doing a TCA chemical peel. When I was a resident at Tulane, I did chemical peels on everybody. We had limited resources with the lasers, and so I did a lot of chemical peels. Now, I love chemical peels. I think of the results as being very similar to some of the results you can get with a laser. So first thing about them is you can get rid of brown discoloration. What it does is it causes damage to the surface of the skin and it lifts off that brown discoloration. We also can get some reduction in fine lines and wrinkles. And with the fine lines and wrinkles, it works by taking off that superficial layer. The skin gets traumatized and thinks, oh my gosh, I've got to stimulate some new collagen. So you can get rid of some of those fine lines as well. So what we do is with the TCAs, it can hurt. It can hurt a lot. And so we want to put a little topical numbing on. We have patients do this 15 to 30 minutes before the treatment. And we just let it soak in and it makes it much, much, much more tolerable. Because when I used to get them done on my own skin, it would hurt and a lot, like take your breath away kind of hurt. With the topicals, it doesn't hurt as much. So we do need to get this ointment off though, and we also want to get the normal grease off the skin as well as any kind of dirt that may be on a person's skin. And it's shocking actually how much dirt and debris is on somebody's skin. Even after they take a shower, oftentimes there's a little bit. It's really important to get all the grease off though, because if you have grease on there, it blocks the chemical peel from penetrating the skin. So what we're doing is we're really degreasing Todd's face here. Now, Todd, you're a pro with this. How many chemical peels would you say you've had?
Probably 20.
20?
Yeah.
And have they been TCAs or have they been light chemical peels?
I started out with like chemical peels, glycolic, and
Okay, those don't count.
yeah.
Okay, so how many of the big daddy TCAs have you had?
Oh, like 10 or 15 then.
10 or 15? Mm-hmm. Okay, so that's still quite a few. And look at how nice Todd's skin is looking. He looks great.
Todd, is that your go-to beauty secret? TCA?
I call it my gateway drug.
Now, with chemical peels, they come in different concentrations. There's superficial chemical peels, and superficial chemical peels typically just take off the outer layer of the skin called the stratum corneum, and which allows products to penetrate better. It may help stimulate a little bit of new collagen production and may lift off a little bit of brown discoloration. And things that are superficial chemical peels include glycolic chemical peels, you have salicylic acid peels, we have, what's that other one? Help me out here.
Beta
Peel, Jesner peels. So those are really the very superficial peels. They're lunchtime peels. And for the most part, they don't have a lot of downtime. With the medium depth peel, which is this TCA peel, it goes a little bit deeper and it's going to take off more layers of the skin. And so you're going to get more dramatic results. Now, TCA can also be used for scar treatments. I don't use it. The technique is called cross, where we use a very high concentration into a acne scar. And what it's supposed to do is it's supposed to wound it and help to lift up that hole. And just by wounding it, it lifts it up more and more and more. I've never been successful with that. But the point is that higher concentrations are going to do more damage and there's much higher risk of getting complications. Now, the complications would be loss of pigmentation and it would also be scarring. So I tend to hover in the middle concentration of TCA peel, which would be 25 to 35%. And I found this to be very safe. Now, the end point we're looking for when we're doing a chemical peel is going to be a light frost. And I know a lot of people do these at home, and I've seen people that have bought the product online, because you can get anything online, hyaluronic acid, which are fillers, you can get probably even Botox. I know people are just doing everything at home. So I get a lot of do-it-yourselfers that come into our practice with moderate to severe complications. And with a TCA, like I said, if you're not doing it right, you can actually cause scarring. And I know those who are do-it-yourselfers are like, I've never had a problem. I don't like to mess with things that can cause permanent damage though, so I'm a little cautious with this.
The
yes.
The CDPC is asking, what's the recovery time for sun exposure?
Okay, so that's a very good point. So anytime we wound the skin, and with this, it's going to start peeling about 3 to 5 days after we do the peel, and it will continue to peel for up to 7 to 14 days. Now, if it goes beyond 14 days, we know we're in trouble because if something doesn't heal in 14 days, you're probably going to get scarred. So after the skin peels, you get a little bit of redness. And so the redness, you want to be very careful with sun exposure while you have the redness, because that can lead to, if you're in the sun, it can lead to hyperpigmentation or darkening of the skin. And this has happened to me because I got all excited and I wanted to go to an outdoor party and I didn't wear my sunscreen after my skin had healed, and I had raccoon eyes for a year. So you want to be very, very, very careful with the sun exposure after. You don't want to use your chemical sunscreens or the physical blockers until the skin has completely healed. And because if you put the chemical blockers on when the skin is still in the healing phase, you are going to get a severe burn. It's going to burn your skin and you can get contact dermatitis from it. And so it's better off to just wait until after the skin is healed completely. And like I said, that's going to be typically about 14 days. So now what we're going to do is we're going to start with the TCA acid. Like I said, I like concentrations between 25 and 35%. And you can get the same result with a 25 or 35%. With the 25%, you may have to do more passes than with the 35%. But I like this because it's much more controllable to me. Because if I'm not getting the frost I want, I just add a little bit more. If you're doing a TCA, you're layering that strong acid on. And if you layer the second layer on, it's going to burn just as deep as the first layer. And so you might get that discoloration or a scar or something like that. So here we go. And Todd, are you ready? Is there anything you want to say before we start, Todd? Nope. Okay, so I just am putting a thin layer on the skin.
Can you talk to us about the 3 skin cell cycles? Takes about 18 weeks. Like his skin is going to feel a little...
Yeah, so after lasers, particularly ablative lasers or chemical peels, because they're kind of ablative, I tell people your skin isn't going to be totally normal until you've had 3 skin cell cycles. And it takes approximately 6 weeks for the skin to cycle or turn over. And so 3 times 6 would be 18 weeks before your skin will go back to normal. Because sometimes the skin actually doesn't even, it doesn't look quite right. It can be still edematous or look even more wrinkly after you have a treatment, just because the skin hasn't completely healed. So people get impatient, but you have to be a little bit patient with this kind of stuff. And you can see Todd's already getting a beautiful frost. See that light frost that he's getting? That's exactly what we're going for. And we'll be able to tell how good I was at degreasing him based on how even the peel is here. You can see right here, it's not activating quite as much, and so I probably didn't degrease it enough there. And his forehead also is not activating quite as much as I'd like it to. Now, one thing you have to be careful of when you're applying the TCA is you don't want it to run. So you can tell I keep this moist, but I don't keep it too moist. Because if it gets too moist, it will run down his neck, and in a lighter skin tone person like Todd, it can leave a streak of discoloration on his neck.
Okay. And then is this just for the face?
Oh, that's a great question. This TCA can be used on any part of the body. And so we use it on the arms, the legs, the chest, the neck. And what's nice about it is it's pretty safe in those areas. We have to be careful with off face, because the face actually has a lot of hair follicles. Even if you're a woman, it has a lot of very fine hair follicles called vellus hairs. And so it's safer to get more aggressive with the face. Once you get off face, it's just not safe. The other thing that aids in the healing is the face really has great vascular supply. And you can see here, I probably didn't degrease as much because he's only getting freckling of the pigmentation, whereas on the cheeks, he's getting much more even frosting. So if we go, this side is a really nice even frost here. Here it's a little more speckly, and that's probably where I didn't get enough degreasing. And up here you can see it's much more speckly even. So I don't like to overshoot, because we don't want to lead to, like I said, scarring or discoloration. I'm going to actually do his upper eyelids too. So he's doing great. We also do this, you can actually get a chemical peel, and it gets paid for by insurance if you have a condition called actinic keratoses or precancers. So that's a nice service for our patients, because not only do you get rid of the precancers, but you also look younger and fresher. Because brown blotches on your skin make you look older. And this is one of the signs that young people use to grade how old somebody is. That's their number one criteria on how old somebody looks, is based on the number of brown spots they have. So it's really nice to get rid of those brown spots.
Doctor, does this help with acne?
Chemical peels are actually really great for acne. Now, you don't have to do something this deep, because you don't have to take off the superficial layer of the skin. One of the thing that causes acne is plugging of the pores. So all you really need to do is unplug those pores, and the best one for acne is going to be to do a beta peel, which is an a beta hydroxy acid, which is salicylic acid. The property that salicylic acid has that makes it better for acne is that it's lipophilic. So it can go into those oil glands and exfoliate the debris. So that's your number one peel if you have acne. Okay, and I think we're looking really good. So now this is self-neutralizing. By that, what I mean is it will stop penetrating, so you don't have to worry too much. After we're done with, when we've gotten the frost that we want, now sometimes I push it a little bit, but the bright lights are making it harder for me to be as precise as I'd like to be. I guess I'm kind of like seeing spots and stars right now, Todd. Is it white? Is he white?
Yeah, that's really good.
Somebody can be my eyes. Okay, so then what we do is we just have this kidney basin full of ice cubes and water, and we just sort of put a little bit on the, we just wipe it off because we don't want it to continue to penetrate. And then we try to make it more, we try to pamper him just a little bit. Because Todd's always pampering me with lasers.
So will he wash his face tonight?
Gentle cleanser, very gentle cleanser, and you want to just keep a little bit of ointment on it. We have things like cyclophate that people think may improve the healing time, but really the big thing is don't pick it. So my 3 rules after a peel or a laser that's ablative are no sun, no picking, and keep it greasy. So it's very, very, very simple. And now go ahead.
What do you recommend? Like, you know how for the peeler, people love to like peel their skin when it starts to peel off?
No picking. That's my number 2. No sun, no picking. No picking.
So what do you recommend for people that are pickers, natural pickers?
Oh, wow. I have some ideas. Wear gloves. Cut your fingernails. Have somebody handcuff you. Is that the one you wanted, Kylie? She wanted handcuffs.
Briefly, Paris Traveler came in late. What procedure are you doing?
Oh, this is the TCA chemical peel. It's a great treatment that we use to get rid of fine lines and brown spots. And like I said, it also may tighten up your pores. Pores are a tough topic, but it may help tighten up the pores. And we're actually in the completion phase, and Todd's going to do it day by day. Will you have your commitment, Todd? Mm-hmm. Are you sure, Todd?
Yes.
Oh my God. Now, Todd, you went through this so quietly. What were you thinking about while you were doing it?
It starts out and it feels very cold when you put the TCA on. Then it burns a little bit, but I would say it's no higher than a 3 or a 4 out of 10. It was very tolerable.
So were you thinking about the peel, or were you thinking about Christmas, or were you thinking about lunch, or what were you thinking about?
I was listening to you.
Oh, you were? Okay, Todd could give this because he is a peeler. So if you have any questions about chemical peels, let us know. We do all types of chemical peels here. The one chemical peel that I forgot to mention was a phenol chemical peel. And the phenol chemical peel is the deepest chemical peel. And this was something that was very popular, and I guess it would be because I started with a laser clinic in Tulane in the late 1990s. So people were still doing a lot of these deep peels called phenol peels. And people liked them because they did eliminate fine lines and wrinkles, particularly around the mouth. But they were causing such deep penetration that it was leading to white discoloration and a porcelain-like scarred look a little bit. Now, some people liked it. I never liked it. That is, I hate to totally disparage them because a friend of mine, Hal Brody in Atlanta, he's the world expert on chemical peels. And he really knows the right concentration, and he still uses those chemical peels. And I'm certain that he can get a good result without causing scarring. But now that we have these great lasers, I'm more of a laser person. I collect lasers, and so I find the results very predictable, and I don't have to worry about putting on too thick of a layer of the phenol peel and causing the scarring. So this is a very safe treatment. And we do a lot more lasers right now because they're a little bit more precise. You can see his penetration is not completely regular, and but it's pretty close, whereas a laser we can get be much more precise with what we're targeting.
I have one more question for
Yes.
you. How often will Todd have to do this?
Chemical peels, I recommend every 6 months. But if you're really wanting to get more of a result, you could do every three months, 2 to 3 months. So, yes. So thank you for tuning in. We appreciate your support on Instagram, Facebook, and YouTube. You guys are the best. We love our audience, and thank you so much for being so supportive for us. And happy holidays.
Awesome.